Hello everybody, we are back at Ask the Vet. I have some questions from some fanciers. First question, which vaccine do you recommend for Salmonella? Another question was in Dutch. I like a lot of vaccinations, but I hear and read a lot of opinions from veterinarians about Salmonella vaccines. Could you try to give your opinion about this and which vaccine you recommend? Thank you. And another question was from David Allison. What treatment do you advise for paratyphoid and how long to treat and when to treat? There are a number of vaccines. There were a number of vaccines in the past commercially, but several of those commercial vaccines do not exist anymore. It depends on where you live, which country you live, so I would always recommend you ask your veterinarian in the region where you live what to use. I use a lot of auto vaccines. It means that we were able to get the Salmonella strain, so the bacteria from an autopsy, for example, or from a culture, from feces. So we make from that bacteria, we make a vaccine for that colony. So most of the times I use those auto vaccines. You have to let it make it in a lab. There is also a vaccine here where you can use a strain that is a vaccine, a live vaccine from for pigs actually, but it is the pigeon Salmonella that they use for that vaccine. So you are able to use that for vaccination as well, but you have to dilute it correctly. Always ask your veterinarian how to do this, ask your veterinarian. And the other question, what treatment? So I always advise to first treat for paratyphoid and after this vaccinate. But we have a lot of problems nowadays with resistance of Salmonella strains against a lot of antibiotics. Most of the antibiotics that were used in the past for paratyphoid in a lot of cases do not work anymore. I have here, I will show you an antibiogram. So this is a list of antibiotics, that how sensitive the antibiotics are to use for that strain, for that Salmonella strain. And if you look at that antibiogram, you see that a lot of antibiotics that were used in the past, for example, trimethoprim sulfa. Here you have also chloramphenicol, you have their nitrofurantoine. Those are all antibiotics that were used a lot and still are used sometimes a lot for paratyphoid, but you see for this strain those antibiotics do not work anymore. So I try to use the correct antibiotics. For example, in this case you see this strain is sensitive for enrofloxacin, is sensitive for amoxicillin. So those are antibiotics that you can use. You have to do it long enough, so 10 days, and if there's a problem more, so longer, it could be 2 weeks, it could be even 3 weeks, and after that vaccination. Okay, thank you for your interest and do not hesitate to ask more questions about this or other topics. Bye!